shunt down the multiple food allergy route. Feeding difficulties, if this child will not eat and is taking really low volume feeding, then you want to get control of the situation. All the international guidelines say FPIES is an indication, and this is the other one I really like, is if you look at the perianal region and that skin is breaking and not just going red, but breaking down completely, then you should end up using to get control as an amino acid, but not for the long term, just for the short term, because just like asthma, you're going from high grade to low grade treatments. So then we expanded this indication from this paper to just this mnemonic, just to make people remember things. So cow's milk protein allergy, teach your physicians. You're going to think about when you use extensively hydrolyzed most of the time, but not on cost. You should be doing it on clinical grounds and when to use an amino acid formula, and remember things like his beautiful wife and stuff like that to just indicate when you get control. But control should be short-term, not long-term, because you're going from intense treatments to less intense treatments. Amino acid formulas being your intense treatment, extensively hydrolyzed being your low-grade asthma treatment, if you like. But the other reason why people are now getting more obsessed with cow's milk allergy is that cow's milk allergy can present through the ages because it's a long-term disease, not a short-term disease. Now, the first indication is this. So Jonathan Spergel and Hill, what they showed is cow's milk allergy. These are all the foods that we can become allergic to. If you look, there's this big peak, and then there's acquisition of tolerance, and then you're getting a problem because there's still a cohort of children that have got cow's milk protein allergy lifelong. I think it's really interesting that, we're just as guilty. Formula companies think about 0 to 1. But what do we do with the cow's milk allergic child after the age of 1? People say, we'll just go back onto normal formula or drink cow's milk. Actually, the majority won't do it. 54%, we can tell you, won't do it. And that's our data, is it shows that a huge number of children, only 46% can go back to drinking milk at the age of 1. So 54%, you need a strategy. And I think there are lots of different ideas about how we should be dealing with the over the age of 1 with cow's milk protein allergy, because generally, if they do start drinking milk, it's going to be much later in life. So there's the 1 onwards, the toddler strategy, if you like, for cow's milk protein allergy. So then, just recently, we just published this, where we started recognizing that cow's milk protein allergy can start with blood in the stools, proctocolitis, eczema, the FPIES, or these dysmotile or chronic FPIES, as the Americans like to call it, and it all disappears. So you get a bit of a window after 2 to 3 years as a parent where life feels good and there's no symptoms. And then what happens is if you've got a friendly allergist, they're starting to get asthma, hay fever. So if you have cow's milk protein allergy, you have this, which is long-term disease that's going to keep the allergist busy. Then the gastroenterologist comes back with EOE and what we call extraintestinal manifestations like sweating or bladder dysfunction or autonomic dysfunction, especially in the hypermobile group. And what you see is an association with functional gastrointestinal disorders. So what happens is this, is you get a shift and your allergy is shifting. Even the LEAP study, which shows that 15% of the world is cured by introducing early peanuts. What's the problem with the LEAP study now is you're starting to see an increase in cashew allergy. You're starting to see an increase in other atopic conditions. And in milk allergy, well, you get this. You get reflux, you get cow's milk protein allergy. That gets better, so the parents have a quiet time. And guess what? They get bellyache. So they start coming back. And if you see a bellyacher who's had an early symptoms like this, Miguel Schaap shows that if you've got early symptoms of milk allergy, you have a 5-fold increase of bellyache and conditions like this. And in these children, I will restrict raw milk. But then you have a friendly allergist, and you have to give him the child again because they pop over to them for the asthma and the rhinitis. And then you come back to the gastroenterologist who's dealing with eosinophilic esophagitis, and they're dealing with irritable bowel disease, irritable bowel syndrome. But equally, there's an increase in inflammatory bowel disease as well if you're cow's milk allergic. Children who get cow's milk allergy, who have tolerance acquisition, do better in terms of numbers of rates of IBD than if you don't get tolerance acquisition. So this is a long-term disease. You should be thinking about that and what strategies can I do? Shift from an amino acid to an extensively hydrolyzed. And it's just shifting. And the LEAP study, which everyone is lauding, shows that you get peanut allergy acquisition, but then it's shifting. Your immune system doesn't like being beaten, and it will go over to cashew allergy, and then you'll get an increase in hay fever. So it's a fascinating well that where we're pushing one problem away, it's just squeezing out the side and coming out the other end. Cow's milk allergy is no different. So I think of it as a gastroenterologist like this. I first meet the family, and here I'm feeling really good. I've cured them, I've discharged them, and lo and behold, they pop up with their second child, but the older one, who's sitting in the corner and said, oh, you treated him before, or her before, and guess what? They've got bellyache. And then they go away again, and then suddenly they come back with functional gastrointestinal disorders. So you never really get rid of your patients, and see. And John, you probably never got rid of any of yours, did you? So this is long-term disease. And I'm not going to go into much about this, but we're now beginning to understand what this involves and why you don't really want to use PPIs because it kills your pathogens. It also increases the risk of allergies. And we know that mucosal barrier protection is really an epithelial integrity. The name of the game is creaming that gut. And as Roberto will tell you that he's probably the best person I know at doing that. And you also want to do tolerance induction. So these are all the mechanisms we're now facing. I want to talk to you about the 1,000 days, and we had a conversation about it yesterday. I think the 1,000 days, I challenge you all to look at when people present the 1,000 days. And what they do is they present the first year of life, really, really important. But what happens between the age of 1 and 2? You see very little data on the age of 1 and 2. So should the 1,000 days be called the first 500 days? Because we don't have a lot of time to sort this out. Delays in diagnosis are a problem, and if we do delay diagnosis, what you're going to end up with is children who are in trouble, and I don't think you can rescue them much beyond the age of 1. So we have a massive responsibility as pediatricians to get those first 500 days. And Rahman, yesterday, when he was presented, I actually think the 1,000 days might need to be shifted to preconception onwards, not just conception. He was made a really important, and the EQ stuff that Regina, you presented yesterday, I was looking at the cutoff and I was thinking, hold on a minute, you really need to get to them before the age of 1. See, we have a massive responsibility in cow's milk allergy to deal with them in the first 500 days rather than even the first 1,000 days, because even your microbiome is reasonably set at the age of 1. So we really need to get our act together to get this sorted. And John, thank you for this slide as always. Dysbiosis, you're going to hear a lot about bad bugs, good balances, right strains, wrong strains. Because of this, what you're trying to do with all these bugs and barrier bugs is you're trying to do this: improve the barrier with various muck proteins. You're trying to improve your profiles with symbiotics or probiotics, but what you're really trying to do is improve your fatty acid profiling called butyrate, acetate, and propionate. You're trying to get tolerance acquisition with your immune system and strategies of cow's milk allergy. But the other thing that I think is absolutely fascinating, what I'm going to finish my talk on, is that I'm going to talk about intrinsic nerves and extrinsic nerves, your brain-gut axis. Mood is really key in cow's milk protein allergy, and quality of life is. Hormones, GLP, PYY, and ghrelin, and satiety, and hunger, and the stuff you saw Rahman present yesterday are also gut-driven. So this mechanism of how we improve tolerance acquisition, how we improve the fatty acid profiles, are inducing immune system, but they're also working on a plasticity of nerves. Your gut nerves are also formulated between 0 and 1, your first 500 days. If you're hammering them, and you saw some lovely data about brain sort of development, if you watch the enteric nervous system, and remember your gut nerves, their numbers are only secondary to your brain and spinal column, is if you get it wrong, you're going to have long-term disease. So enteric nerves are really plastic, and they're really formulating in the first year of your life, the same way as your microbiome is. So not to forget gut nerves, because you get this. So you can play this video. Video, please. So what do you see? You see back arching, posturing, stiffening. This is pain, yeah? So when you say, I'm going to leave you, and so Regina, you were saying about yesterday, I thought it was fascinating. So I'll just come back in a few minutes, dear. You just settle yourself down. You can't with milk allergy. This is different, yeah? This is pain, it's posturing. It's obviously a British baby, by the way. That's the Union Jack, for those of you who don't know. Let's see. So this is different. Thank you. Yeah, so this is pain, yeah. But if you think about the long-term implications of this, about quality of life, EQ, long-term outcomes, yeah, I read this fascinating fact that if we can sort EQ out, you'll have less prison sentences and you'll need less prisons in the whole world. It's a fascinating fact, yeah, see. And this is because of this nervous system is called the enteric nervous system. A good friend of mine who's down in Australia now, Nick Ilfappa, this was his lifetime's work. He's showing that this nervous system, it's just like your microbiome, it's developing, it's maturing, and the first year of life is set for life. And it's a really complex system of these these receptors called the interstitial cells of Cajal. And these actually have the same receptors as allergy cells on them. And if you look at those receptors, these interstitial cells of Cajal, the mast cells down here, the basophils and eosinophils, they're